how difficult, actually, is it to track the virus and keep a handle on it? The UK government took everyone by surprise by saying that there would be a quarantine from travels returning back from Spain. This was on Saturday. No one was expecting it. I mean, does it suddenly flare up and countries have to put people in quarantine?
It's been really difficult to track, and I think that's the challenge. And we're looking around the world. If you look at Hong Kong, for example, which used to be ground zero for an excellent coronavirus response, relaxation on travelers coming into the city resulted in a surge in new cases. And so I think countries around the world, the UK among them, trying to prevent a second or third wave of the virus. But tracking is very difficult because so many people are asymptomatic.
Carla, what is so important here, and with your expertise on China, and for that matter, broader North Asia, they're taking the virus on in a very rules-based way. They make a rule and society has to do it or else. Now, in America, we don't do that. Do you feel things would be better here if we did it more like what the pandemic police are doing in Asia?
Well, I don't think that using coercive measures is a good idea as an American. I would prefer that people use sense, and it's very clear now that we understand the science a bit better that the virus can be mitigated by mask wearing. If everybody wears a mask, the spread of the virus is reduced. Yeah. It's been politicized in the United States, that is mask wearing, and so people aren't wearing masks, and you can see that all over the place. But places like New York, which have used strong enforcement measures, have seen very significant improvements to the situation and are able to manage the virus.
Francine, it is stunning, Francine. Much of this mathematics is from Johns Hopkins University. Francine, it is absolutely stunning, the persistency of excellence of New York State over the last 60 or 70 days. I mean, it's just jaw-dropping, the differential between other states in America.
Oh, yeah, Tom, but we have a great story about Lionel Laurent. The problem is that it could be 60 to 70 days like we saw in Spain, right? I mean, they got a handle on the virus and then people relax. So it's
exactly.
You know, like the model is very difficult, Tom, because you can be doing great and then actually not so great after a couple of months.
Carla, one of the news flow things we see today away from the virus is the extradition battle with China. We sort of decided, yeah, it's a big deal, but is it a big deal? I mean, the UK had an extradition agreement with China that's been broken, and now Canada and others. Is this a big deal?
Well, it is a big deal because it signals increasing problems between the Chinese and governments around the world with which who have very different political systems from China, and many of those, it's a list as you mentioned, the UK, Canada, and other democracies, including the United States, are weighing whether to sustain their extradition treaties with China in Hong Kong. It's a big deal too because Hong Kong, it's been such a key way of managing many of the criminal networks that flow through that region. So suspending that or ending those agreements will have an impact on crime, but it's also part of the bigger political set of political tensions that's dividing increasingly the world between China and the United States.
Carla, there's talk about, espionage and things like that, about research. If you look at the world over, who has the best research into this pandemic? Is it first movers advantage? Is it China?
China has some excellent research, and a lot of that was done in conjunction with international researchers. And China has a set of labs, many of which were working with international partners. But there are numerous initiatives around the world, Korea, the United States, China, Europe, to develop a vaccine. And there's a lot of great science going on right now. So I think the United States is on the verge of perhaps rolling out a couple of potential vaccines. We've got some tests going on. We have excellent research in this area as well. I'm not sure whether it's better than China. They've done a lot of research, obviously, since the SARS epidemic of the early 2000s on coronaviruses. So they may have some of the best information on that. And in fact, the WHO is going to be sending a team to China to try to track the origins of the virus.
What are the chances that we'll never get a vaccine?
Well, that is a possibility. We're just learning more and more about this, and it looks like this is a highly mutable virus, and it may be difficult to develop a single vaccine for it. It may be more like the flu vaccine, but there are also other ways of treating this that may prove more effective than a vaccine. Lots of different paths potentially to manage this medically.